Imagine walking into a Walgreens or a CVS today. You've got a nasty cough, maybe a sore throat. You walk down the aisle looking for something strong. You grab a bottle, pay for it, and head home. But if you were to step into a time machine and walk into that same pharmacy in the year 1898, the pharmacist wouldn't hand you NyQuil or Tylenol. He would reach behind the counter and hand you a small glass bottle labeled with one word: heroin. Yes, that's right, heroin. The same drug that is now considered a Schedule I controlled substance, illegal, dangerous, and life-ruining, was once the pride and joy of the pharmaceutical world. It wasn't sold in back alleys, it was sold by one of the most respected companies in the world, Bayer. The same people who make your aspirin. And here is the kicker: they didn't just sell it to adults. They marketed it specifically as a safe, soothing medicine for children. How on earth did this happen? How did modern medicine get it so wrong? This is the story of the time we gave heroin to babies. To understand why anyone thought this was a good idea, we first have to look at the world of the late 19th century. It wasn't a pretty place. In the 1890s, the world was suffering from a massive health crisis. Tuberculosis or consumption was rampant. Pneumonia and bronchitis were basically death sentences. Antibiotics didn't exist yet. If you got sick, you coughed. You coughed until your lungs bled, you coughed until you couldn't sleep, and often you coughed until you died. Doctors were desperate. They needed something to stop the coughing and the pain. At the time, their best weapon was morphine. Morphine was effective, sure, but it had a massive downside. It was incredibly addictive. By the late 1800s, there was an epidemic of morphine addiction, especially among soldiers returning from the Civil War and the Prussian Wars. The medical community was on a frantic hunt for a substitute. They wanted a miracle drug, something that could kill pain and stop coughs like morphine, but without the addiction. Enter Felix Hoffmann. Hoffmann was a brilliant chemist working for Bayer in Germany. In 1897, he was having a very productive year. Within the span of just 2 weeks, he synthesized 2 new drugs that would change history. The first one was acetylsalicylic acid. You know it today as aspirin. It was a home run. It changed the world of pain management forever. But the second compound he synthesized was diacetylmorphine. When the team at Bayer tested this new substance, the employees reported feeling amazing. They felt powerful. They felt heroic. So, the marketing team at Bayer decided to name the drug based on that feeling. They called it heroin.
Bayer ran tests and came to a shocking conclusion. Not only was heroin more effective than morphine at stopping coughs, but they also believed it was non-addictive. They were convinced that by boiling morphine and adding an acetyl group, they had removed the addictive properties. They thought they had found the holy grail of medicine. This is where things get truly bizarre by modern standards. In 1898, Bayer launched a massive, aggressive global marketing campaign, and I do mean aggressive. They sent free samples to thousands of doctors in the United States and Europe. Newspapers and medical journals were flooded with ads. And the main selling point: no side effects. One medical journal from Boston in 1900 claimed, "Heroin possesses many advantages over morphine. It's not a hypnotic, and there is no danger of acquiring a habit." Because they thought it was safe, they started pushing it for the most vulnerable patients, children. There were ads featuring smiling mothers spoon-feeding heroin to their sick kids. It was prescribed for everything. Baby crying too much, heroin. Toddler has a cold, heroin. Grandma has a sore throat, heroin lozenges. It became a household staple. It was the super aspirin of the early 20th century. Doctors prescribed it to patients trying to quit morphine, thinking it was a safe bridge to sobriety. Ironically, they were curing a morphine addiction by giving patients something even stronger. The honeymoon period lasted about a decade, but slowly, the truth started to come out. You see, when you ingest heroin, the human body breaks it down. And what does it break it down into? Morphine. It turns out, heroin is basically just a delivery system for morphine, but it crosses the blood-brain barrier much faster. That heroic rush the early testers felt? That was the drug hitting their brain with incredible speed. By the early 1900s, hospitals in New York and Philadelphia began noticing a disturbing trend. Patients weren't just getting their coughs cured. They were coming back for more. They were selling their possessions to buy more cough syrup. The non-addictive miracle drug was creating a new class of junkies. doctors realized they had made a catastrophic mistake. In 1913, Bayer decided to stop making heroin. They quietly pulled it from their product lines and decided to focus entirely on their other invention, aspirin. But the damage was done. The genie was out of the bottle.
It took the United States government until 1924 to completely ban the importation and manufacture of heroin. For over 20 years, one of the hardest drugs on the planet was as easy to buy as a candy bar. Today, we look back at those vintage ads with horror. It seems insane that a doctor would give a baby heroin, but it serves as a humble reminder. Science is a process of learning. What we consider safe and miraculous today might be looked at very differently by history 100 years from now. So, the next time you take a spoon of cough syrup, just be thankful. It might taste like cherry-flavored garbage, but at least it's not heroin. If you enjoyed this strange trip into history, make sure to hit that like button. And tell me in the comments, what is a modern medical practice you think people in the future will find crazy? Don't forget to subscribe for more dark history. Thanks for watching.